Welcome to This Week in Erie. We're talking vampire facials, lasers, and all things to make you feel and look better. And joining us now is Dr. Lynn with the Lecom Glow Laser and Beauty Center. Doctor, tell us about this. This is a reopening of the center. It's not new, but it's a rebirth of sorts.
Sure. I started aesthetic medicine about 24 months ago, and it just grew to the point where we outgrew our old space, and now we're at the Medical Fitness Wellness Center on the third floor, and we have an entire suite dedicated to anti-aging as well as aesthetic medicine.
And you said it's been growing. What's the response been to the new space?
It's been really great. So we moved in here September 22nd, and we've been really booked, overcapacitated, so it's been really a good response. But we have more room, and obviously we added staff, so we're able to accommodate all the patients that wanted to get a consultation and treatments.
Well, and also, obviously, in this COVID world, maintain protocol to keep everybody safe.
Sure. So as this is a Lecom building that we're in, we have the same stringency of screening for patients coming in, and we have appropriate PPE available to patients and our staff. So we take every precaution before we do any procedures here.
Now, I mean, there are other, med spas and things in Erie. Obviously, you're a doctor. That's extremely important to have someone on staff who's an actual doctor. But I also noticed, too, the vampire facial, which the name alone, is interesting. So tell us about that.
Sure. Vampire facial was developed by a doctor down in Alabama. His name is Dr. Charles Reynolds. He essentially leverages platelet-rich plasma, which has been known to, in the orthopedic world for many, many years, to heal tendons and ligaments and so forth. But he leveraged that to rejuvenate skin as well as some volume when we age, to regenerate volume and stuff. And the vampire facelift, facial vampire, is actually a proprietary name. So in order to be able to use the name vampire facelift and facial, the practitioner and myself would have to get trained by him. So we actually went down to Fairhope, Alabama for him to train us.
So the actual guy who created it?
That's right. Oh, wow. That's right. And he, so after, and there's actually a network of all of us. We belong to what we call Cellular Medicine Association. So there's over 30,000, I believe, practitioners that actually perform this procedure over the country, but you have to be able to be certified in order to use the name vampire.
Now, we have put one of our staff, Stephanie, she's going to be going through this, and we're going to take a look at what happens. What does this facelift do for someone getting that procedure? So
as we age, there's what we call 3Ds. There's usually a descent and deflation of volume, as well as deterioration of the skin, right?
That sounds beautiful.
So really, this procedure hit all three things, right? So we use one syringe of the filler to strategically place areas that we lose volume as with the natural aging process. Then we follow up with the PRP injection. So all the patient that comes into this procedure, we will draw 20 cc's of blood, and there's a very special machine that we spin the blood down. We capture the PRP, which is the growth factors. That's what we call liquid gold. That contains 7 or 8 different types of growth factors that would eventually help work alongside the filler to fill the volume, but also the growth factors can help rejuvenate blood vessels, color, and skin tone and texture, etc.
Who's the perfect candidate for this?
Well, I think anybody, as we age, once we hit, sort of past 35 or 40, the natural process is that we start losing facial volume from
Everything
the fat pad.
Right.
So if you're an individual who enjoys the sun, who also is in that sort of age group and stuff, you'd be a prime candidate to get started. And this is a really good maintenance type of a procedure, and also treatment. If you sort of are in your 50s and 60s, you've lost significant volume, this would be one of the procedures that we will start with to help you, rejuvenate back to hopefully 5 years younger, that type of thing.
And I've heard sometimes people think they're going to get more done, and then they get the vampire facelift, and they say, wow, I really don't need much more right now.
Right, and really the nice thing about this procedure is we're leveraging your own body's growth factors to regenerate volume rather than using 2 or 3 or 4 different syringes of fillers. And those fillers can be very expensive because it's 1 cc, and the retail price for those fillers is somewhere between $650 to $750, depending on which filler you use. So this way, we're actually rejuvenating and putting volume, almost 6 cc's of volume, back into your face to help you rejuvenate.
Okay, so here we're at the Glow Laser and Beauty Center, and of course, Stephanie's our guinea pig for the vampire facelift because the recovery for that's a little bit longer. But of course, I couldn't come here and not try something out too, so you had an idea for me.
Yeah, so we have many different modalities of treatment, and we come up with a care plan depending on what you need. So one of it is our laser. Laser is a very important part of non-invasive rejuvenation for aesthetic medicine. So our laser is a Cyton laser that we can talk more about as I'm doing the procedure. But really, the BBL is called broadband light therapy, and it's really been revolutionary in terms of rejuvenating face for non-invasive physicians to help patients. And there are many things that it does very well, and one of which is especially pigmentation. So as we age, because of the sun and environment, we get sun damage and hyperpigmentation from the UV light. In addition, as we age, sometimes we just have those red spots and those veins that pop out in our face that makes our face red. So an individual that have rosacea and or vasculature that is showing on face, the BBL can help get rid of that very, very easily with no downtime. And it's what we call a 15-minute lunchtime facial because it's just we flash with light. But in addition to that, it's got many, many side benefits in terms of rejuvenation. The deep light that goes penetrate into the skin can help stimulate collagen production as well as skin tightening because of the heat and the laser. And the Dr. Patrick Bitter is actually one of the pioneers. This is the godfather, we call him, for broadband light therapy. And he did a study with Stanford, and he actually showed at a molecular level, if you maintain regularly BBL treatments and stuff, it can actually turn the aging gene off on your skin cells. Anybody can Google his name, and you'll see that he BBLs himself every 6 weeks, and he looks better at 67 now than he did when he was in his 40s.
Well, that's a tall order. We'll see if
yeah,
you make me
yeah,
at least look
yeah.
45.
We're excited to do that.
Well, doctor, so other things too, you typically offer other services here. Someone can just give a call and see maybe what works for them?
Yes, absolutely.
I'm sure a consultation though too.
Yeah, so typically the normal process is you will call and make an appointment for a consultation. I would evaluate what you need, and we'll discuss the treatment plan. And usually there will be a plan that we come up with, and that would involve a variety of different types of treatment modalities to get you to what we agree on, what your goals are in terms of rejuvenation. So in addition to just facial and skin, one of the big things that we do here is actually non-invasive body contouring. So there are other spas in town that does cool sculpting. We also have cool sculpting, but one of the unique things that I do is that I always couple the cool sculpting with the laser therapy, that with the same machine I was just telling you about. But it does two things. One is it can get rid of the unwanted subcutaneous fat, but in addition, with the laser, we can help tighten the skin that we just got rid of the volume, so that the skin does not sag. So
all kinds of things to consider.
Yeah,
Doctor,
yeah.
thank you so much for having us, and congratulations on the grand reopening.
Well, thank you very much. Thank you for coming.
Thank you, and that does it for This Week in Erie.